A year ago, just 1 month before the COVID-19 lockdowns, when no one was wearing a mask, we followed Dr. Dan Baruch into his lab, where he and his team were laser focused on finding a vaccine to combat an alarming new coronavirus.
It's impossible to say how long or the extent of the current outbreak, but it is likely that it will continue to get worse before it gets better. When it actually gets better is not clear at this point.
Now a year and more than 2 million deaths later, even he's been shocked at the virus's global rampage.
Never in our wildest imagination would we have anticipated that the pandemic would have unfolded the way it has.
Now Americans could soon be rolling up their sleeves for a third vaccine that Baruch helped create with Johnson & Johnson. Unlike the other two vaccines, it's easier to store and requires just one shot. If approved, it would mean more people getting vaccines much faster.
We think those two properties as a single-shot vaccine, as well as no sub-zero freezing required, would facilitate the logistics of vaccination of large numbers of people.
The Johnson & Johnson vaccine uses a deactivated form of a common cold virus to carry a piece of the COVID-19 DNA into the body and trigger an immune response.
The reason is because common cold viruses are really, really good at doing one thing, which is getting into human cells. So we're basically commandeering that property. Once it's in cells, the protein is made and the body makes an immune response to it. That's essentially how the vaccine works.
But any success is tempered with fresh worry. New strains of the virus. They could make vaccines less effective.
I'm very concerned about these new variants. The emergence of variants that are more contagious, possibly at least partially resistant to antibodies induced by infection or vaccines, and the threat of the emergence of future variants increases the need for everyone to comply with public health measures, such as masking and social distancing, as well as accelerate the vaccine campaign and get people vaccinated as quickly as possible.
As the race to find vaccines has also become a race against a changing virus. Liz Neisloss, GBH News.